Okay, so let's unpack this. We're diving into a topic that really touches so many lives, doesn't it? Either directly or, through people we know.
Absolutely.
Navigating change when it comes to heavy alcohol consumption. I mean, shifting habits like that, ones that are deeply ingrained, it's just profoundly complex.
It really is. And finding paths that actually work, whether that means like cutting down or stopping completely, it's a huge area of study and, well, personal effort too.
Yeah, definitely. And what immediately stands out from this stack of sources we've got here, it's just the sheer diversity of approaches people have documented.
That's right. It's clear from the research, that there isn't one single problem. It's more like a spectrum of experiences, right?
Mm-hmm.
And so the potential paths towards change are just as varied. They're multifaceted.
Exactly, which is why we gathered all this material. We've got studies, research summaries, notes exploring all these different avenues people have taken.
And crucially, found documented success with. That's the key part, reducing or stopping heavy drinking.
Right. So our mission, I guess, in this deep dive is to sort of guide you through this material.
Yeah, we want to distill the most significant findings, kind of walk you through the different approaches the sources talk about. And it spans everything, really.
Like what?
Well, plant extracts, conventional medications, even surprising new areas like the gut microbiome.
Oh, interesting.
Yeah. And also the powerful impact of like environment and mindset shifts that the research has documented.
Right. So think of this not as us looking for one simple solution, like a magic bullet,
No, definitely not.
but more as an exploration. We're looking at the diverse toolkit of insights, strategies, interventions, all supported by documented research we've got here.
Exactly. It's about offering perspectives, maybe some aha moments drawn directly from the data in these sources, helping you understand the landscape of what the research suggests is actually possible.
Okay, so where do we start? Maybe with the big picture.
Yeah, let's start with a sort of foundational finding that underpins all of this, according to the sources anyway.
Yeah.
The general landscape they paint. It's one of possibility.
Okay.
Studies have documented instances across all sorts of approaches of heavy drinkers successfully reducing their consumption or, achieving abstinence.
That's such a critical point to ground us, isn't it? The research actually confirms that change is achievable.
It is.
And the sources show us how researchers have observed this, how they've measured it happening through different means. It kind of sets the stage for exploring all the methods and insights that follow.
Precisely. And one significant area the sources detail is what we can probably call the pharmacological toolkit.
Okay. Medications and natural stuff.
Yeah, the use of medications and natural extracts that have been studied specifically for their effects on alcohol consumption. The research points to several different substances, and each has documented outcomes and proposed mechanisms for how they might work.
All right, let's get into that part of the material then. One that seems to pop up quite a bit in the sources is Kudzu extract,
Yes, Kudzu.
and specifically its component puerarin.
That's right. The sources highlight Kudzu extract. It comes from the root of the Kudzu plant, has been investigated for its potential to decrease alcohol intake in heavy drinkers.
Uh-huh.
And puerarin is noted as one of its active components, one of the things believed to contribute to this effect.
Okay. And there's a particular study mentioned from McLean Hospital that feels pretty illustrative. Can you walk us through what the sources say about that one?
Sure. The McLean Hospital study involved 14 volunteers. They were characterized as having drinking problems.
Right.
And what makes this study particularly interesting, according to the sources, is where they did it. It was in a simulated natural environment.
What does that mean exactly? Like a lab?
Sort of, but designed to feel more real. Like a comfortable setting mimicking a living room or maybe a bar where people might typically drink.
Okay, got it.
Participants were given access to their preferred alcoholic drinks, and after just 1 week of treatment with Kudzu extract, which contained puerarin and some other related compounds, the study documented a substantial reduction in the amount of alcohol they consumed.
Compared to before they started?
Compared to a baseline period, yeah.
Yeah.
A substantial reduction.
Wow. And observed in a setting that deliberately tried to mirror a real-world drinking situation. That feels like a really key detail.
It does.
And do the sources offer a theory, like a proposed mechanism for how Kudzu might be doing this?
Yes, they do. And the theory outlined in the sources is actually quite intriguing. It suggests Kudzu might work by prolonging or maybe enhancing the acute, immediate effects of the first drink.
Huh. So you feel it faster or stronger?
That's the idea. It leads to earlier satiation. Individuals feel the desired effects, maybe relaxation, maybe mild euphoria more quickly, or perhaps more intensely after consuming less alcohol. And because they reach that point of satisfaction sooner, they're then inclined to stop drinking earlier in that episode, which results in reduced overall intake during that specific occasion.
Okay, so for someone who struggles with moderation once they start drinking, where that first one often leads to many more,
Right.
a mechanism that helps them feel done sooner, that could be incredibly relevant, couldn't it?
Absolutely. It directly targets that aspect of controlling intake during a drinking event, as documented in the sources.
Makes sense.
And the sources also mentioned other studies that seem to reinforce this line of thinking. There was one trial with non-treatment seeking male heavy drinkers. They used a specific standardized Kudzu extract called NPI 031,
Okay.
and that also reported a reduction in alcohol consumption. Another study looked at the effect of just a single dose of Kudzu extract in a binge drinking model and found it led to reduced intake there too.
Even a single dose. Interesting.
Yeah. And there was also a pilot study that looked at Kudzu root specifically in patients with chronic alcoholism.
And what about side effects? That's always a big question with any kind of treatment. Was anything mentioned in the sources regarding one of these studies?
Yes, actually. In one of the studies discussed, the sources make a point of noting that no reported side effects were observed that were significant enough to hinder long-term compliance.
That's really crucial, isn't it? Because for any intervention to actually work long term, people have to be able to tolerate taking it consistently.
Exactly. It has to be practical.
Agreed. Okay, so moving on in these pharmacological options documented in the sources,
Yeah.
we have nalmefene.
Nalmefene, right. This is another medication that sources highlight. They point to evidence from two double-blind, placebo-controlled studies.
The gold standard. Yeah.
Pretty much. These indicated nalmefene successfully reduced heavy drinking and also helped prevent individuals from relapsing back into heavy drinking.
Okay, so two distinct but really important goals. Reducing current heavy drinking and preventing a return to heavy drinking.
Precisely.
And the sources also described a specific way nalmefene is sometimes used, something about as needed.
Yes, that's one of the key findings highlighted about nalmefene. It comes from a set of 3 randomized controlled trials known as ESSENCE 1, ESSENCE 2, and SENSE.
Okay.
These trials explored using nalmefene on an as-needed basis, which basically meant patients would take the medication when they thought they might be in a situation where they could drink heavily.
So sort of preemptively.
Kind of strategically, yeah.
Oh.
And this as-needed approach was used alongside a psychosocial support program called Brenda.
Right, so not just the pill.
No, combination therapy. And across these trials, the sources report that this approach significantly reduced both the number of days with heavy drinking and the total amount of alcohol consumed.
Significant reductions in both.
Yes. And they also mentioned improvements in liver enzyme levels were observed in those trials too, which is a good sign for physical health.
As needed really is quite different from taking something every day, isn't it? It puts some control back with the individual using it strategically.
It does. And that combination with psychosocial support seems notable too.
Definitely. What about nalmefene's effect on craving? Does it help with that urge?
The sources also note that nalmefene was reported to reduce cravings specifically, the craving experienced after taking the first drink.
Ah, that specific moment.
Exactly. This was seen in individuals with alcohol dependence who weren't actively seeking formal treatment when they were in the study. And that trigger moment right after the first sip can be a huge factor in continuing to drink. So targeting that craving is a distinct mechanism.
Yeah, that makes a lot of sense. Okay, shifting gears a bit. The sources also discuss topiramate. Now, that's an anticonvulsant, right? Used for epilepsy or migraines.
That's right. But the sources link it to reducing heavy drinking as well.
How so? What did the studies show?
Well, the sources cite a specific double-blind, placebo-controlled study that associated topiramate with a reduction in heavy drinking among the participants.
Okay.
According to that study, topiramate had a documented effect on reducing the amount of alcohol consumed on days when people did drink.
So, drinking a less quantity on drinking days.
Exactly. And it was also found to reduce craving during the actual drinking period itself.
Reducing quantity and reducing the urge while drinking. Those are quite specific effects.
They are. And the source also adds that topiramate can potentially increase complete abstinence.
Stopping altogether.
Yeah, particularly for individuals who experience what's described as compulsive craving.
Compulsive craving.
Yes. And importantly, the sources mention that based on the strong evidence presented in this material, the NI, That's the National Institute on Alcohol Abuse and Alcoholism in the U.S.
Right, a major agency.
They support the use of topiramate as an option for treating alcohol use disorder. That level of support, based on the cited evidence, really highlights its significance among the pharmaceutical options discussed here.
Yeah, that definitely underscores its importance in the field. Okay, what about gabapentin? That's another one, also used as an anticonvulsant that the sources mention.
Gabapentin, yes. Another medication highlighted with documented effects on alcohol consumption. Studies mentioned indicate that gabapentin can increase the rate of complete abstinence and also reduce heavy drinking.
So again, similar potential for either stopping entirely or significantly cutting back based on the research.
That's right.
And the sources also mention a study comparing gabapentin combined with another medication, naltrexone.
They did. This comparative study looked at people receiving a combination of gabapentin and naltrexone versus those just getting naltrexone alone.
And what did they find? Was the combo better?
The findings, as reported in the sources, show that the combination therapy significantly extended the period of time before a heavy drinking episode happened.
Longer time between heavy drinking days.
Yes. And it also resulted in fewer days with heavy drinking overall, and a reduced total amount of alcohol consumed on those drinking days compared to just using naltrexone by itself.
So in that specific comparison study, the combination approach had better documented outcomes on several measures. And the sources noted another potential benefit of gabapentin, didn't they? Something about sleep.
Yes, that's right. A finding noted in the material is that gabapentin was reported to have a positive effect on sleep.
Yeah.
And this connects back to you, the listener, in a practical way. The sources suggest that some interventions might have multiple benefits that support overall well-being during, the challenging process of changing drinking habits.
Right, because sleep problems often go hand in hand with heavy alcohol use, don't they?
They often do. So a medication that could potentially help with both, according to the research cited, offers a potentially wider scope of benefit.
That's a really valuable point. Addressing co-occurring issues like sleep could be very supportive for someone trying to make changes. Okay, let's turn to acamprosate now.
Acamprosate. This one is primarily discussed in the sources for its role in supporting and maintaining complete abstinence after someone has stopped drinking.
So helping people stay stopped.
Exactly. It's often described as helping to reduce the sort of psychological discomfort or dysphoria, that kind of unease that can happen after quitting alcohol.
Right, addressing some of those post-cessation challenges. So its main job, as presented in the sources, is really about maintenance.
That's its primary documented role. However, the sources do note that some meta-analyses mentioned in the material have found that acamprosate can also contribute to a reduction in heavy drinking, even if full abstinence isn't achieved right away.
Okay, so maybe some effect on reducing drinking too, but primarily for abstinence.
Right. But there's an important comparative point the sources also make here regarding acamprosate.
What's that comparison?
Well, a large meta-analysis cited in the sources this pooled data from 122 randomized controlled studies and one cohort study.
Wow, that's a lot of data.
Huge amount. It specifically compared acamprosate and naltrexone. Now, both medications were found to be helpful in meta-analyses for treating alcohol use disorders generally. But this specific comparison found no significant difference between acamprosate and naltrexone, specifically in preventing heavy drinking.
Ah, okay. So on that specific measure, preventing heavy drinking, they performed similarly in that big analysis.
Correct. So while some analyses show acamprosate can help reduce heavy drinking, its primary documented role, and where it's most consistently discussed in these sources, is really in maintaining abstinence.
That helps clarify its documented effects and how it stacks up against naltrexone on that specific metric based on that analysis anyway. What about baclofen?
Baclofen. This is introduced with a proposed mechanism that makes it a bit different. The sources suggest baclofen might work by reducing the positive reward effect of alcohol.
Making it less reinforcing.
Essentially, yeah. Making drinking less pleasurable or reinforcing.
Okay, reducing the reward. How would that proposed mechanism translate into actual drinking behavior, according to the sources?
Well, the sources explain that this hypothesized effect is suggested to lead individuals to consume lower doses of alcohol when they do drink, simply because the reinforcing feeling isn't as strong.
Makes sense. Less reward, less motivation to keep going.
Right. The material also references a small study that indicated baclofen was effective in leading individuals to achieve complete abstinence.
So stopping altogether in some cases.
Yes. And furthermore, for participants in that study who didn't achieve full abstinence, baclofen still resulted in a reduction in their alcohol consumption.
So, potentially helping people either stop entirely or cut back significantly by altering the subjective experience of drinking itself. That's a pretty distinct angle among these different pharmacological approaches described.
It is. Now, the sources list quite a few other pharmacological interventions that have been studied.
Yeah.
Rather than go through every single one in exhaustive detail, maybe we can group some of these based on the types of outcomes the sources report.
Yeah, that makes sense. Just to give people a sense of the breadth of the research without getting totally bogged down in every single drug name.
Exactly. Let's look at the documented effects of some of these other substances mentioned.
Okay.
So, for instance, carbamazepine is discussed. The sources note it's been shown to reduce the amount of alcohol consumed on drinking days,
Okay. Less quantity again.
and also to extend the period of abstinence for patients who have already stopped drinking, so helping them stay sober longer.
Got it. Helping people drink less when they drink or stay sober longer once they've quit. Seems useful.
Uh-huh. Then there's Valproate. According to the sources, it's predicted to help prevent relapse into heavy drinking and is noted as supporting abstinence.
Preventing relapse and supporting abstinence, similar documented goals there.
Right. Oxcarbamazepine is highlighted as being effective in maintaining abstinence, particularly when used at higher doses, based on the studies cited.
Another one supporting ongoing sobriety, especially at higher doses.
Okay. Aripiprazole. In a small study referenced in the sources, this one showed a significant reduction in the number of days with heavy drinking compared to a placebo group.
Significant reduction in how often heavy drinking occurs. That's a key metric of change, isn't it?
Definitely. Then there's quetiapine. This is discussed in the context of duly diagnosed individuals,
Yeah.
people with both alcohol use disorder and another psychiatric condition.
Right. Complex cases.
Very. The sources report that quetiapine was found to decrease alcohol consumption, reduce craving, and improve psychiatric symptoms in this specific patient population.
Wow. So addressing multiple challenges simultaneously in individuals with co-occurring conditions, according to that research, that's impressive.
It suggests a potential role there. Ondansetron is also mentioned. That's a medication sometimes used for nausea.
Oh, really?
Yeah. A randomized controlled trial cited in the sources showed ondansetron reduced drinking specifically in what they termed biologically predisposed alcoholic patients.
Biologically predisposed. So, suggesting that maybe genetic or biological factors might make certain people more likely to benefit from this specific treatment. That's what that study indicated.
That seems to be the implication from that particular trial's findings, yes.
Interesting.
Varenicline also appears often known for helping people quit smoking, right?
Yeah. Chantix.
That's the one. Well, the sources note that in studies involving heavy drinking smokers, varenicline reduced both alcohol self-administration and consumption.
Both smoking and drinking.
In that group, yes. Furthermore, pilot clinical trials, specifically for alcohol dependence, separate from smoking, showed promising results.
Huh. Interesting how interventions for one substance can show promise for another based on the research.
It happens. Memantine is another one sometimes used for Alzheimer's disease. It showed potential in a pilot double-blind treatment trial for alcohol dependence, according to the sources.
So promising pilot data suggests it's on the research radar, maybe needs more study.
Exactly. An area of ongoing exploration. And finally, just circling back briefly within this pharmacological group, we should mention naltrexone again. It came up earlier in comparisons, right?
Right, with acamprosate and gabapentin.
Well, the sources provide strong evidence supporting naltrexone's effectiveness in decreasing cravings and reducing alcohol consumption in heavy drinkers. As we noted, meta-analyses show it's broadly helpful.
So strong documented support for naltrexone, directly targeting craving and consumption, major drivers of heavy drinking.
Absolutely. And there's one more substance mentioned, but with a really crucial distinction we need to make clear. That's cannabidiol, or CBD.
Ah, CBD. Definitely getting a lot of attention everywhere these days. What do the sources say about its potential in this context for heavy drinking?
Okay, it is absolutely vital to note, and the sources explicitly state this, that the findings reported for CBD here are from preclinical studies.
Preclinical, meaning not in humans, mostly.
Primarily, yes. Research conducted mainly in lab settings, often using animal models like rodents. The goal is to understand basic mechanisms and see if there's a signal worth pursuing in human clinical trials. These are not results from large-scale human efficacy trials for treating alcohol use disorder.
Okay, that's a critical distinction. Preclinical. So understanding that, what did these preclinical studies, the ones mentioned in the sources, actually find?
The preclinical studies discussed consistently showed several potentially relevant effects. In animal models, CBD was found to reduce ethanol intake.
Okay.
It also reduced the motivation to consume ethanol. And crucially, it showed potential in reducing relapse and the reinstatement of drinking behavior after a period of forced abstinence, what they call extinction.
So potentially helping prevent going back to drinking after stopping?
That's what the preclinical data suggests. The sources also note that this data indicated CBD could reduce anxiety and impulsivity. And those factors, anxiety and impulsivity, are often correlated with increased ethanol intake in both animals and, well, humans too.
Right. So the early stage preclinical research points towards several potential targets for CBD. Reducing consumption, reducing the drive or motivation to drink, potentially helping prevent relapse, and maybe addressing underlying factors like anxiety.
Correct. But again, the sources are really careful to emphasize this is preclinical data. It needs further human study to see if these effects translate.
Got it. Preclinical promise needs human validation.
Precisely. It's an area being explored based on these initial findings. So, okay, to wrap up this pretty extensive look at the pharmacological toolkit documented in the sources, we've seen a really diverse picture, haven't we?
Yeah, definitely.
From plant extracts like kudzu, maybe impacting the immediate experience of drinking, to medications like nalmefene used strategically to cut down heavy drinking days. Others like topiramate and gabapentin influencing consumption, craving, abstinence, maybe even sleep. Baclofen potentially reducing the alcohol's reward effect. And then a whole range of others targeting various aspects like relapse prevention or addressing co-occurring conditions.
Plus those early preclinical signals for CBD.
Right. It connects back to you, the listener, by illustrating that researchers, as documented here, are exploring a multitude of biological pathways and psychological processes involved in heavy drinking and reducing it.
It really highlights that there isn't just one chemical fix being sought, is there? It's more like a complex interplay of potential targets.
Exactly. Okay, so moving beyond the pharmacological interventions, the sources also detail some fascinating non-pharmacological approaches and key observations drawn from studies about how change occurs.
Right. This is where we see other powerful forces at play, according to the documented research.
Yeah, different kinds of tools and insights.
This feels like a bit of a shift in perspective, looking at documented ways people have reduced or stopped drinking that don't necessarily involve taking a substance. The sources mention brief interventions first.
Brief interventions, yes. They're described in the sources as typically pretty concise, often just 1 to 3 sessions.
Really? That brief?
Yeah. The core components usually include an abbreviated assessment of someone's drinking, then providing personalized motivational feedback based on that assessment, and offering clear advice about reducing risks associated with heavy drinking.
Brief is certainly accurate based on that description. Are these short interactions actually documented as being effective?
Well, the sources indicate that generally, brief interventions are found to be more effective than getting no intervention at all. That seems
I think
logical.
it's better than nothing.
But significantly, the material suggests they are often comparable in efficacy to more intense or lengthy treatment programs.
Really? Comparable to longer programs?
Particularly for individuals with less severe alcohol use problems, yes. The sources also propose that brief interventions might even increase the effectiveness of more intensive treatment if someone decides they need that later on. Kind of primes the pump, maybe?
So a relatively minimal structured interaction focused specifically on the drinking behavior can actually move the needle according to these studies. That's quite a powerful finding.
It is. And there's a specific randomized controlled trial mentioned in the sources that focused on physician advice. This was given to older adults who screened positive for excessive drinking.
Okay, advice from their doctor.
Right. In that study, just 2 sessions, each lasting only 15 to 20 minutes.
That's it.
That's it. Where a physician gave advice based on a brief assessment. And it led to documented significant improvements. Participants showed significantly greater reductions in the number of drinks consumed over a week, a lower rate of 30-day binge drinking, and a lower rate of overall excessive drinking compared to a control group.
Just 2 short sessions of physician advice led to those statistically significant improvements in that trial. Wow.
It really underscores the point, doesn't it?
Yeah.
Even short, targeted, structured interactions delivered by a trusted source, as shown in this research, can have a measurable impact.
Absolutely. Okay, now let's touch on something that might seem quite surprising based on the sources. Fecal microbiota transplantation, FMT.
Right, FMT.
Okay, my ears definitely perked up there. The gut microbiome. How on earth does that connect to heavy drinking and change according to these sources?
It's a relatively newer area of research in this specific context, But the sources include some really fascinating findings. They discuss studies involving human patients who had alcohol-associated cirrhosis and alcohol use disorder.
Okay, serious health issues related to alcohol.
Very serious. In these patients, FMT procedures were associated with reduced alcohol consumption and also decreased cravings.
Reduced drinking and cravings after FMT?
Yes. And the sources also note that these patients showed an increase in the diversity of their gut bacteria after receiving the FMT.
Huh. So, changes in gut flora composition linked to reduced consumption and cravings in humans with severe liver disease from alcohol and AUD.
That's a biological pathway most people probably wouldn't immediately connect to changing drinking habits.
Not at all. And the sources add another human study. This one focused on patients with severe alcohol-associated hepatitis. It's a life-threatening condition.
Even more severe. Yes. In these severe cases, FMT was associated with decreased alcohol relapse rates and an increased time until relapse occurred, compared to a control group.
Decreased relapse rates and longer time to relapse in a population facing incredibly severe health consequences. Those are significant documented effects, even in a really challenging clinical context.
Very significant. But perhaps the most striking detail from the sources about FMT comes from the preclinical cross-species studies.
Okay, back to animal models.
Yes. The sources document research where fecal matter from human individuals with alcohol use disorder was transplanted into mice.
Okay.
And what they observed was that alcohol preference and intake were reduced in the human patients who got the FMT. That's one finding. But remarkably, the behavioral outcomes specifically, the altered alcohol preference and intake, was found to be transmissible to the mice who received the FMT from the human AUD patients.
Wait, hold on. Let me get this straight. The sources document research showing that transferring gut bacteria from humans with AUD into mice changed the mice's drinking behavior.
That is precisely what the sources describe from these studies.
Wow.
It's a powerful finding, even if it's preliminary in the grand scheme. It highlights the profound and maybe unexpected influence of the gut-brain axis on complex behaviors like alcohol consumption.
Yeah, profound is the word.
It strongly suggests that biological factors within our gut microbiome, as shown in this documented research, could play a real role in vulnerability to, or maybe recovery from, alcohol use disorder. It opens up entirely new avenues for exploration and potential intervention.
That finding alone feels like a genuine aha moment based on the documented research. Just incredible. Okay, moving to another documented observation. The sources discuss insights gained from hospitalization.
Yes, hospitalization. One study cited in the sources included both qualitative, like people's experiences, and quantitative findings about being hospitalized.
Okay.
Several participants reported that being hospitalized, often for serious health issues directly caused by their heavy drinking. It served as a profound wake-up call.
A reality check.
Exactly. Or, as one passage in the source put it, it initiated droplets of awareness, like a gradual or maybe sudden realization of the severe physical harm their alcohol use was causing.
So the undeniable physical consequences right there in front of them during hospitalization became a catalyst for thinking about change.
Precisely. The hospitalization made that connection between their drinking and their physical deterioration completely unavoidable. It prompted them to reflect on their habits.
Makes sense.
And the environment of the hospital itself was also noted in the sources as playing a role.
How so?
Well, simply being in a setting where alcohol wasn't available for a period of time, that increased their self-efficacy.
Their belief they could do it.
Their belief in their own ability, yeah. Specifically, their ability to sustain abstinence after they were discharged. It demonstrated to them, in a very real way, that they could function and exist without alcohol for a period.
So the combination of that forced break from drinking and the stark reality of the physical consequences seems like a powerful, albeit probably very difficult, documented catalyst for change.
It seems so. And there were quantitative findings alongside those personal observations in the study, too.
What did the numbers show?
The quantitative analysis in the same study reinforced the impact. Across all the variables they measured, from baseline before hospitalization to follow-up after discharge, the study documented significant positive changes collectively among the participants.
Okay, overall positive changes.
Yes. And here's a crucial nuance mentioned in the sources. Even for individuals who had what was termed an unfavorable drinking outcome according to strict criteria, meaning they still had at least one heavy drinking day during the follow-up period.
Right, so not perfect abstinence.
Not perfect abstinence, but even they still showed a documented significant reduction in their median weekly alcohol intake and a decrease in the severity of their alcohol use disorder compared to their levels before hospitalization.
That's a really important point from the sources, isn't it? It wasn't necessarily full abstinence for everyone, but just the event of hospitalization, for many, was associated with a documented significant reduction in both how much and how often they drank heavily and their overall AUD severity.
Exactly. It highlights how major life events and environments, even really challenging medical ones, can play a profound, documented role in initiating and supporting significant positive change.
Yeah, a powerful, if difficult, catalyst.
Mm.
Okay, next up, the sources get into the concepts of self-efficacy and the role of motivational interventions.
Right. Self-efficacy, as mentioned in the sources, is essentially an individual's belief in their own capability to successfully execute a specific behavior. So in this context, it's about believing you can reduce or stop drinking.
This seems absolutely fundamental to the whole process, right? I mean, if you don't believe you can change, how motivated or effective are you likely to be in trying?
It certainly feels fundamental.
So what did the sources say about this connection and about interventions designed to maybe boost that belief?
Well, this area presents a slightly complex picture based on the different findings cited in the sources. It's not entirely straightforward.
Oh, how so?
One meta-analysis mentioned looked at 11 studies focusing on Alcoholics Anonymous, AA, participation and outcomes.
Okay.
It found that changes in self-efficacy were inconsistent across those studies. And furthermore, the degree to which enhanced self-efficacy actually translated into better drinking outcomes. Well, that wasn't consistently observed across all the included studies in that particular meta-analysis.
So that specific analysis of AA studies didn't find a clear, consistent link between increases in self-efficacy and better drinking outcomes.
According to that specific meta-analysis, no. However, the sources also mentioned other studies that seem to paint a somewhat different picture, particularly regarding structured therapeutic interventions.
Like therapy.
Yes. One study showed that structured therapeutic approaches like functional analytic psychotherapy and psychoeducation were effective in reducing alcohol addiction among participants.
And those kinds of therapies often work on building skills and confidence.
Yeah, right. They often explicitly work on building coping skills and, yes, self-efficacy. So that suggests a link there, even if it wasn't crystal clear in the AA meta-analysis mentioned earlier.
Okay, so structured psychological therapies were shown to be effective, and they often involve building self-efficacy. That implies a connection.
It does seem to. And another study mentioned in the sources specifically examined the impact of drinking refusal self-efficacy.
Drinking refusal self-efficacy. What's that?
It's the belief in your ability to successfully refuse a drink when it's offered, or maybe when you feel pressured.
Ah, the ability to say no.
Exactly. And this study revealed that this specific type of self-efficacy had a substantial documented effect on drinking behavior.
That makes a lot of intuitive sense, doesn't it? Believing you can actually say no would directly impact whether you drink or not. And the source confirms a measurable, substantial effect for that specific kind of self-belief.
It does. The sources also note that interventions that focus specifically on alcohol use reduction or abstinence, including peer-driven interventions, appeared more effective within overall treatment programs, according to one source.
Suggesting that targeting the specific behavior and the beliefs around that behavior might be particularly impactful.
That seems to be the implication. So based on these sources, the pictures may be a bit nuanced. While general self-efficacy changes weren't consistently linked to outcomes in one analysis, targeted psychological therapies were documented as effective, and the specific belief in one's ability to refuse alcohol showed a substantial effect.
It highlights the complexity, doesn't it? How internal beliefs and different types of therapeutic approaches interact with the whole process of changing drinking habits.
Indeed. And related to this, but also distinct, is a truly powerful theme woven through the sources: the concept of self-directed change.
Self-directed change. This means individuals making significant changes to their drinking outside of traditional formal treatment programs, right? Like on their own.
Precisely. The sources make it very clear that change can occur, and does occur, with or without formal treatment interventions. They discuss findings related to this, including a study focused on an online mutual aid community called SwimorDig.
SwimorDig, an online support group. What did the study looking at this community find about documented change? Was it effective?
The study examined both active members and also people who just browsed the site, lurkers, I suppose. It found that individuals engaging with this online group demonstrated sustained positive changes in their drinking behavior.
Sustained positive changes just from being part of an online group.
That's what the study documented. And for some, the online community served as what the sources describe as a stepping off point.
A stepping off point.
Yeah, like it facilitated the initial changes, gave them momentum, and that sometimes led to continued abstinence, even after they stopped actively participating in the online group itself.
Wow. So the support and connection within that online community provided the initial push for change, and that momentum actually carried forward for some even after leaving the group.
That's what the findings suggest. And a particularly significant finding from that study, mentioned in the sources, was that many participants who initially identified themselves as problem drinkers and stated that their goal was simply to cut down on their drinking.
Right. Moderation was the goal.
Moderation was the stated goal.
Yeah.
But many of them ended up achieving complete abstinence instead.
That's fascinating. They set out just to cut down, but the process itself, maybe influenced by the community or their own efforts, led them to a more significant change, stopping altogether.
Exactly. It really illustrates how the path can unfold in unexpected ways.
Yeah.
Based on these documented outcomes.
Yeah. It shows the journey isn't always linear.
Definitely not. The sources also include some anecdotal accounts that support this idea of self-directed change. Stories from individuals who reported eventually deciding to do it on their own, sometimes after trying formal treatments that maybe they felt didn't meet their needs or weren't effective for them personally.
You know, this part of the sources feels incredibly validating. It highlights that while formal treatment is absolutely vital and life-saving for many people,
Of course.
it's not the only documented path. Internal motivation, the power of finding community, even if it's online, and just personal resolve, they're clearly shown to play significant roles in achieving positive change, according to this research.
Absolutely. It acknowledges that agency people have.
Mm-hmm.
And lastly, just quickly, in this section on non-pharmacological approaches, the sources briefly mention behavioral self-control training.
Behavioral self-control training. Okay.
They just note that this particular method has demonstrated documented long-term positive outcomes in helping individuals manage their drinking.
So another structured, non-pharmacological approach focused on skills and behavior change that has shown lasting effects, according to the sources.
Right.
Okay. So we've really explored a wide spectrum here, haven't we? Documented interventions and observations from specific medications and plant extracts targeting biological or experiential aspects of drinking to the, frankly, surprising potential influence of the gut microbiome.
Still amazing.
The powerful impact of significant life events like hospitalization serving as catalysts, psychological factors like self-efficacy, the strength of community and self-direction.
It's a very broad and I think hopeful picture. It reveals that many different forces and tools can contribute to change. And the sources also provide some overall outcome statistics that give a realistic sense of what success often looks like.
Right, including acknowledging the reality of relapse.
Yes, relapse is definitely a common challenge in the journey of changing any entrenched habit, especially substance use. What do the sources say about it specifically in the context of treatment outcomes for alcohol use disorder?
Yeah, what's the documented reality there?
The sources are quite clear and realistic on this point. They state that the majority of patients who undergo formal treatment for an alcohol use disorder will experience at least one instance of relapse within the first year following treatment.
The majority experience at least one relapse.
That's a documented reality based on the research.
Okay. That statistic, taken in isolation, could sound pretty discouraging, couldn't it?
It absolutely could, but the sources immediately balance this by emphasizing the overall positive outcomes that are still achieved despite that. While relapse is common, the crucial finding highlighted repeatedly in the material is that most individuals still drink less frequently and consume significantly less alcohol after treatment compared to before.
Okay. So that's the key takeaway. Even with relapse being common, the overall trend is significant improvement.
Exactly. Documented success often looks like substantial life-improving reduction and fewer heavy drinking days over time, rather than necessarily immediate, perfect, and permanent abstinence for absolutely everyone.
That makes sense. It's about progress, not necessarily perfection right away.
Precisely. And the sources offer specific data points to illustrate this. They report that patients typically describe heavy drinking on about 75% of days before starting treatment.
3/4 of the time. Wow.
Yeah. But in stark contrast, after treatment, The same patients report achieving complete abstinence on 70% to 90% of days
70 to 90% abstinence.
and experiencing heavy drinking on only 5% to 10% of days.
Wow. Okay, going from heavy drinking 3/4 of the time down to heavy drinking on maybe just 5 or 10% of days with abstinence most of the time, that is a dramatic, documented reduction in the frequency and impact of heavy drinking for the majority.
It really is, even with the reality of occasional relapse acknowledged.
That represents a profound improvement in quality of life and health for so many individuals.
Absolutely. And the sources further reiterate this point by stating that approximately 70% of patients show a documented reduction in drinking days and demonstrate improved health status within just 6 months following treatment.
70% showing reduction in improved health within 6 months. That's pretty fast improvement for many.
It suggests treatment can work relatively quickly for a large proportion of people.
So these numbers from the sources provide a realistic but ultimately very encouraging picture of documented success, don't they?
I think so.
It confirms that substantial, meaningful change is very achievable, and that progress is often measured by significant reduction and overall improvement over time, even if the path isn't perfectly linear and includes setbacks like occasional relapse.
Right. It's not necessarily an all-or-nothing outcome in the documented reality of these studies.
Yeah.
It absolutely highlights the documented progress and the substantial positive shifts observed in the research landscape.
Okay, so let's try and bring together all the threads of what we've explored in this deep dive. We've delved into this stack of sources detailing a really wide array of documented interventions, observations, pathways, all related to reducing heavy alcohol consumption.
Yeah, we covered a lot. We looked at specific medications, natural extracts, targeting mechanisms like craving or that first drink effect, or supporting abstinence. We explored the surprising potential role of the gut microbiome revealed by that emerging FMT research.
Still thinking about that one.
Me too. We discussed the impact of significant life events, like hospitalization, acting as documented catalysts for change. The complex but important influence of psychological factors like self-efficacy and targeted motivational work.
Right.
And the documented power of community support, even online, and the potential of self-directed change.
The core message that seems to emerge from all these sources is powerful, and it seems pretty clear. There isn't just one road.
No.
There are multiple documented paths and tools that have demonstrably helped heavy drinkers reduce or stop consumption. It underscores the complexity, for sure, of changing these deeply ingrained habits.
It does.
But it also eliminates the real hope inherent in having such diverse research-supported options and insights available.
Absolutely. Looking back at the sheer breadth of these findings, it's quite striking, isn't it?
It really is. Okay, so here's maybe a final thought to leave people with, based only on what we've seen in these sources. Consider how these sources document that significant shifts in heavy drinking behavior can be initiated and supported by such incredibly diverse and sometimes really unexpected forces.
Yeah.
It could be a substance targeting brain chemistry,
Right.
or a single dose affecting future behavior, or an online community providing that documented stepping off point towards abstinence.
Or a major medical event triggering a deep internal change in awareness and maybe a realization of self-efficacy.
Or even just the power of personal resolve, deciding to do it on my own.
Exactly.
So what does this sheer diversity of documented success stories, these different paths to reduction or abstinence found in the research, what does that tell you, the listener, about the very nature of change itself? It seems the sources suggest that while change is definitely challenging, profound shifts in behavior are possible, and they can be initiated and supported in a multitude of ways that maybe defy a single, simple explanation.
Which perhaps encourages us to look broadly, right? To consider all the potential forces for change, both internal and external, conventional and maybe less conventional.
Yeah. A complex problem, but many potential avenues toward positive change, according to the research we've looked at today.